So you graduate dental hygiene school, you take your boards, you pass all of your boards, you are so excited. You land your first job as a dental hygienist and you are just over the moon. And then you figure out that real life dental hygiene is so much different than dental hygiene school. And the time that you get in the real world for your appointments is nothing like what you got in dental hygiene school. And you find out that you are super slow and you're struggling to get everything done in time. Well, if this is you, then just keep on watching. What's up guys, welcome back to my channel, or hello if you are new. My name is Rachel and I am a registered dental hygienist, and in today's video I'm going to be giving you 15 tips on how to do your job faster so you're not constantly behind. So my number one tip for you is to always read through all of your charts before your day even starts. So this is something that I do even till this day. As soon as I get into work and I get my scrubs on, I go right into my room and I grab all my charts and I grab my schedule and I start going through every single patient that I'm going to see that day. I'm trying to figure out what patients need pre-med, who needs bite wings, who needs areas that I need to evaluate further, who needs to be perio charted, who needs any special accommodations, anything like that I could just make a quick note by their name so that way I don't have to keep going through every person's chart after every single patient. And that saves me a ton of time and it helps me to feel prepared, because once I'm done with one patient, I already can look at the schedule and automatically know what I need to do and what I need to set up for the next patient. My second tip for you would be to use as few amount of instruments as possible. So I know in hygiene school I had this big beautiful kit of all sorts of instruments that I would be able to choose from. But in the real world, you don't have time to constantly look through all of your certain instruments and pick the best one for you. So my suggestion for you is to pick your favorites and stick to that. Try to stick to universal instruments that you can use all throughout the mouth instead of having to constantly switch between instruments. I typically use about 2 instruments for every single patient. I have an anterior scaler that I love and I have a posterior scaler that I love, and sometimes I'll also have a universal scaler. It's just so much easier than using a Gracie 11-12 and then also using a Gracie 13-14 to scale the entire tooth instead of just using one instrument and you can do all the surfaces. My third tip for you would be to polish first on patients that come in and are just covered in plaque buildup. You can just see that it's just caked on there. So the reason why I would say to do this is because if you don't, you are going to spend so much time endlessly scaling off all that plaque buildup, looking for any tartar or stain underneath. But if you just polish it off first, then you can clearly see things a lot better and you're not going through and having to scale constantly loads and loads of plaque buildup off. This isn't something that I have to do very often because for the most part a lot of my patients are pretty clean, but there are some times when people just come in and they're just loaded with plaque and it just takes up too much time. My fourth tip for you would be to limit your small talk. So I know some hygienists are super talkers and other hygienists are very, very quiet when they do their PROPHYs. I know for me, I'm probably like an in-between type of hygienist. It just really depends on the patient. Some patients I vibe with really well and I talk to like the whole appointment, and other patients I go the whole appointment and it's like crickets. Like no one wants to talk to you, so you're trying to make conversation, you feel like you're forcing conversation, so you just kind of let it go. Now if you notice that you're a big talker and you're constantly always behind, limit how much you're talking to the patient, because you have to remember when you're having a conversation with somebody, they're going to respond back. So they're not just going to listen to you talk for 20, 40, whatever amount of minutes it is that you're in their mouth and just have them not respond at all. They're going to want to say something back to you, and you have to remember that those responses are going to take up more time. Now, if it's about their overall health, that's one thing, but if we're just talking about their dog or what they're doing this summer, just try to keep it to a minimum. My fifth tip for you would be to do your home care instructions while you are doing your PROPHY. So for me, like if I'm doing toothbrush instructions, I will do that while I'm scaling, because clearly while I'm scaling, I'm able to find areas that they're missing when they're brushing. So if I'm scaling the lower anteriors and I'm finding a ton of tartar buildup, I will show them my mirror and I'll say, hey, say this is your toothbrush, here's the handle, here's the bristle part. Whenever you're brushing this area that I'm working at here, hold your toothbrush straight up and down, and I show them and I make them feel exactly how it's supposed to be feeling. I show them in a mirror, I let them look at it, so that way they're able to see which areas that they need to work on better and how they can improve it. Now that also goes for flossing. So instead of talking about flossing at any other time of the appointment, I always make sure I talk about it while I'm flossing. So if they need to adjust their flossing technique, I do that while I'm flossing. So that way, again, they can see and they can feel exactly how it should be done, and you don't have to do everything twice. It's really helpful to have a mirror just behind you to just grab so they can see how it properly needs to be done. One thing I would say for this is definitely to try to avoid doing this, avoid doing any oral hygiene instruction or talking about a lot of things like this while you're polishing, just because it's harder for some patients to be able to hear you while you're doing your polishing. My sixth tip for you would be to watch your doctor's schedule, so that way you're not waiting for them endlessly to do your exams. Your doctor will really appreciate it when you pay attention to their schedule, because that way you're not constantly always looking for an exam in the middle of their appointments. Now obviously it's not always going to work out perfectly, but if you just have a little tick in the back of your mind, a little reminder of where your doctor's going to be at certain times, you can kind of pay attention to when you should go and get them for the exam, even if it's not exactly always at the end of the appointment. Maybe it's right after you take your radiographs. Go and grab them before they get started on a big procedure that you know is going to take a lot of time. Or maybe if they're doing a root canal at the end of the day before they get started on that and you know it's going to take longer than your PROPHY appointment, have them come to the exam first. Get it out of the way so that way your patient's not waiting at the end of the appointment for 20 minutes to get their exam. Tip number 7 is to make sure you always have sharp instruments. So whether this means that you have to always set a time for sharpening your instruments to make sure that they're not dull, or you have a very generous doctor who constantly lets you order new instruments, just make sure that they're sharp, because for one, it's going to help prevent you from burnishing a lot of calculus. It's going to help you from having to overscale the same area 15 times because you can't get underneath it. And it's also going to reduce the amount of fatigue that you're putting on your hand. So I personally don't do very much sharpening because our doctor is very generous and lets us replace our instruments pretty frequently. So we have some favorite instruments that we order on a regular basis, so that way we're always making sure that as soon as our instruments start getting dull, we replace them with fresh ones. Tip number 8 would be to do pre-made bags and pre-made trays. So I always have pre-made trays. We have in our sterilization area rows for every single type of treatment, and we always have a full set of trays at the beginning of every single day, and we're constantly, any amount of downtime, replacing those trays just to make sure that they're ready to go. Even though it doesn't take a lot of time to make a tray, it just helps to eliminate that one extra thing that you have to do when maybe you're already running behind and you're already stressed out about it. Now, as far as the pre-made patient bags, I typically don't do this as much, but I know some hygienists that do, just because I personally like to ask my patients what color they would like for their toothbrush ahead of time, so that way I don't give them the same color that their wife has, or their brother, or their sister, or whoever, and I want to make sure that I'm giving them the certain toothpaste that either that they like, or that I would highly recommend that they should start using. Tip number 9 would be to always use your ultrasonic scaler. So utilize your CAVITRON, utilize your piezo, whatever you have, utilize it. So my first permanent job straight out of hygiene school, I did not have a CAVITRON or any type of ultrasonic scaler at the office. So for about a year and a half, I never really used it, aside from if I was temping. So I became very uncomfortable very quickly with using it because I wasn't frequently doing it. Now I personally will just use my CAVITRON on patients with really heavy calculus buildup or really heavy stain. I don't use it on my everyday really simple PROPHY patient just because I can't feel the calculus as much as I can with a regular hand instrument, but just remember to utilize it to reduce your time on those really difficult patients. Tip number 10, now this kind of goes with the tip number 4, but learn how to redirect your conversations. Some patients are going to come in and they're going to want to talk your leg off, like you're the only person that they've talked to all week. Then other patients, they're going to come in and it's like pulling teeth to get them to talk to you. So those patients who just love to talk and talk and talk and talk and tell you their whole life story, learn how to redirect those conversations. Otherwise, you're going to be spending 40 minutes talking about their neighbor who just built their porch and all the drama that went along with it. So this is something that I kind of had to learn the hard way, because I had a really hard time redirecting patients because I felt that I was being rude by not listening to what they had to say. But at the same time, they're there to have a treatment performed by you within a certain period of time, not to just have a chit-chat coffee break session. So if a patient is talking to me and going on and on and on and on and on about something that is non-unrelated, I will kind of break in and be like,
hey, that was really great to hear, but I also just wanted to make sure that, you didn't have any other health changes before we get started so I can get this treatment going for you.
Something along the line, just so that way they know that, hey, you're listening and you do care, but also, remember that you're here to have a procedure done and we don't have 14 hours to provide that treatment for you. Tip number 11 is to do all of your 12 and 11 o'clock services at one time, and then do all of your 8 and 9 o'clock services at another time. So I know some hygienists that will do the entire cleaning, the entire prophy at one certain position. I personally don't do that. I have two very specific positions that I will always sit at. So I personally will always start at 11 to 12 o'clock, and I'll do all the surfaces that I can do in that area, and then once those are done, I will move to 8, 9 o'clock, and I will do all the surfaces that I can do from that area, so that way I'm not constantly having to switch back and forth. Now, with that being said, tip number 12 is to get a routine down. So I have a specific exact routine that I follow on every single patient, so that way I don't forget anything and I know exactly what I need to do next. This is really nice to prevent any guesswork, and now that I've been doing this for over 5 years in private practice, I tend to switch it up more on occasion just to kind of switch up the monotony in the job and kind of make it more interesting. But for the majority of time, I always do the exact same thing on every single patient, so that way I don't get confused and I don't get lost on what to do next. Tip number 13 is to use your water and your air at the same time whenever you're rinsing out your patient. I always felt like it took me forever to rinse out my patients once I was done polishing them and flossing, because I hate the grittiness that you feel once you leave the dentist, and I don't want to leave my patients feeling like that. I know that they don't appreciate it either, so I always try to make sure that I give them a really thorough rinse so that it feels really nice once I'm done. But one thing that you can do to make that go a little bit faster is use your water and your air at the same time. So using your air is going to help it come out faster, so it's kind of like a little spray hose instead of just a little drizzle. It just really helps to force all of the prophy paste in between their teeth out of there, so that way you can get that done faster. I would say since I started doing it, I've probably cut my rinsing time down at least in half. Tip number 14 is to have everything close to you. Whether you drop something or you forgot to put something on your tray, whatever it is, make sure you always have a little bit of everything that you possibly will need next to you. In my drawers, I have pieces of floss set out, I have pieces of gauze, I have extra prophy paste, I have extra prophy angles, I have an extra mirror, I have an extra probe, like whatever it may be that I may drop on the floor or I may have forgotten to put on my tray. Instead of having to get up and leave your room and go and grab it, it's so much easier to just turn around and grab it because it's already right there and ready in the room for you. Tip number 15 is to always be aware of their dental history, especially if you see something that is suspicious that you want to address with the doctor. So say they have a crown on number 19 and it's looking like it's starting to decay underneath it. It's getting a little questionable. Maybe it's becoming a little mobile, it's becoming a little loose. And then maybe you say you take a PA of it and it just really is not looking great. Look at the chart and see when that crown was placed, so that way when the doctor comes in to check out the patient, you already know what to tell them when they ask, hey, how old is this crown? When was this crown placed? And you don't have to flip through their chart frantically like, oh, crap, when was 19 placed? I can't find it. So always try to make a mental note before the doctor comes in, just so that way you already know the answer to their questions that you know that they're going to ask. Just try to always figure these things out ahead of time to save you and the doctor some time. So if you are already a working registered dental hygienist and you've been in this position where you've been finding that you've been really slow for your appointments, what are some things that you personally have done to speed up the process so that you are not constantly always behind? Let me know down in the comment section below. So I hope this video was helpful for you guys. I really try to think of the top 15 tips to help save you some time so that you're not constantly always feeling stressed out and like you're always behind every single day for your appointments. I want you to love your job, and I want it to be as stress-free as it possibly can be. So I hope you enjoyed watching this video. I hope it was helpful. If you enjoyed it, make sure you hit the like button on this video. I make a ton of dental hygiene related videos, and I have a whole playlist of videos like this one. So if that is something that you are interested in, make sure you hit the subscribe button below to see more of my videos. Thank you again for watching, and I will see you in next week's video. Bye guys!